So we get a lot of messages because we run a lot of advertising. So we do get people who are interested in like starting their dental journey with us. And I know it's frustrating because probably if you have something you want to fix in your mouth, you've probably seen a few health professionals already. So like that's a couple of consultations. And you're like, actually, I'm tired of this. So we get like uh, pictures of their teeth or their mouth, like how much to fix, and it's really a hard question to answer. And because you really have to just come over to the practice. And so we can just talk about it. So we can give you what you need because it's not a one size fits all type of situation. Everyone's different. If I said 5,000 and you're like, that's not bad. And then you came here and then the coach you get is like 10,000, you're going to shoot me in the head. I'm Craig,
And I'm surprised.
and that's what we'll be talking about today. That sometimes online consultations do not work very well in dentistry.
Can you shut up?
Okay, so I'm gonna get into like one of the key fundamentals of dentistry and what makes dentistry unique. Not unique, but different, you know? So it's in dentistry. Everything we do, everything is custom made, you know? You go for that filling is custom made for you. That crown is custom made for you. And that treatment plan is custom made for you. In fact, that's why, if you want to know why, you've never seen a dentist McDonald's. You don't see like 10,000 franchises of one dental brand because it's difficult for us to scale, because everything we do is custom made.
hmm So they won't be like, okay, order five, filling, come on in. Next, you know, it would be nice. It would be efficient. We
Yes.
would make a whole lot of money, but sadly, it just doesn't work. And for you to be able to do that, you'd probably have to multiply yourself. So I'd have to get like 50 dentists, train them, and they train others using the same method that I'm using for us to even scale. But that's besides the point. That's not what we're talking about
Was a
specifically. It
tangent.
was a tangent.
But
Went off the rails for a little bit.
but the tangent is useful because sometimes you'll see like a before and after on the internet, right?
Looks
It
beautiful.
looks beautiful.
Perfect.
Oh, perfect,
Quack, quack, quack.
Wow, wow, wow.
Mm.
Comments, fire, 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 And then you're like, and then you come and you say, I want the same thing. You
Mhm.
show me, like, I want this. In fact, you can say, you did this. I want this.
Mhm. You did it. You can be like, nah, I don't think I can.
I don't
But you did it.
You,
So like,
this is you.
mhm.
Give me that. And I say, yeah, come for a consult. And you're like, well, what do you mean consult? I mean, okay, you come for the consult, and then I tell you, well, it's not possible.
Mm, it's not possible.
Mm.
That patient had so and so. They had all their teeth mostly straight, and the only thing that they needed was just 3 veneers, right, for them to get that type of result. And they didn't smoke, and they didn't have fluorosis, and you have fluorosis. Uh, uh, it was an implant case, and you have diabetes and it's not controlled. Yeah, there's a lot of things that could go into that. So like you don't qualify for an implant, you have to get a bridge. Or before you even get a bridge, we'd have to treat like your gum disease. So it's very hard to actually say, even if we can see that there's gum disease in the picture, there's different variations of it. There's different degrees of it. So like the type of treatment you would need would be severely different from that one. So even the shape of your lips, the shape of your face, the shape of your other teeth could determine how your current teeth are going to look as well. So it's pretty hard to just say, here's what you're going to get. And we're just going to replicate everything we did for the previous patient with you.
And this comes into like something very interesting. Sometimes you come to a dentist and you say, I want the crown. And you're like, let's do a consult. And you're like, Why can't you just jump straight to the crown? That's a good question. But the problem is, let's say you come and you say, I want the crown, but your tooth is not eligible for a crown, right? There isn't enough ferrule.
Tooth structure.
Ferrule. There's not enough of that. And now I can't just do a crown. Step one would mean doing a root canal, doing a post and core, and then doing a crown. So that's why
Maybe even like a crown lengthening,
crown
like to
lengthening.
shape your gum in a certain type of way,
Indeed.
because it just wouldn't work without.
Indeed. So that's why we can't say we did this treatment before it's going to work on you. That's why you can see, I think we've said this in other videos, your friend can come in for one procedure and you say, look, we have the same exact problem. Like it looks exactly the same. We both have two front missing teeth. That's how we became besties.
Mm.
Do you know friendships like that?
I don't know friendships like that, but I do know siblings like that. I'm treating two siblings with the exact same type of teeth, and their treatment is going completely differently from each other. One is almost done, the other might still have a little bit more time to go with the treatment. And that's just it. These are siblings, with like the same, very similar DNA, and have the same missing teeth from birth.
Indeed.
So, yeah.
So
And the treatment is still different.
the treatment is still different. So yes, you guys might have a similar look, but it doesn't mean the underlying structure is the same. One could have longer roots, one could have shorter roots, one could have pre-existing gum disease, one could have healthy gums, one could have, like you said, diabetes, one could be a smoker, one could be, and all those things will affect how your plan will turn out. And that's why we do post before and afters, but maybe sometimes we should add like the results are going to vary for each person.
Results may vary.
Results may vary, like they will vary. Like you might see like a picture of like aligners and the teeth are straight, and you're like, wow, I want that. And then you do it, or you come here and we say, you're not even a candidate for that. Maybe your lifestyle is not suitable for that kind of treatment. Because if you are you lose your car keys, best believe, I don't think aligners are a good treatment for you. You will lose all those trays. So that's why it comes, and that's where our expertise come in to say, yeah, you've got this problem. Again, remember, we're not doing one size fits all. Everything is custom made. Even the plan I'm going to give you is custom made. So yes, you have seen a bridge on the internet, which goes from here to here, but your teeth might not be the candidate for that. So it's always important to understand that when we say you don't qualify for a procedure, or when we say let's do a consult, or when we say this is complicated, it's based on variation that everybody has.
So it's like people with malocclusion, like your teeth aren't straight. The general answer would be you need to come get braces. And we've had patients who've come here wanting to pay, maybe even having the whole cash, the whole amount to just settle everything. And we still have to say, no, we can't help. You'll have to see a specialist, maybe even more than one specialist, because although your teeth don't appear to be straight, but the main problem that you have is based on your skeleton instead of just your dentition or how your teeth are positioned. So you would need a different intervention in that case. Or some of them have retained primary baby teeth that never just came out. And in that treatment plan, we'd have to accommodate that and then also check, do you have any naturally missing teeth? Or when you were in your early teens and another tooth was like coming out from a weird angle, did your dentist remove the permanent teeth or did they remove the baby tooth? So it's very different in that case. And also with like, if you have to replace teeth, there's also like different variations. So like two people can come with two missing front teeth and they'll be like, I want to replace it. How much? What's your response to that?
It depends.
Mm-hmm.
It depends. It depends on what prosthesis you want. It depends on the structure of the teeth next door. Depends on your bone levels. It depends on
Habits.
habits, occlusion. Now, occlusion is very important.
Occlusion is how you bite.
Yeah, so occlusion is how you bite. So that is that's super important, because if you don't have the right occlusion, it disqualifies you from certain things. So your teeth might appear straight, but if you've got like what a tight bite, or you grind your teeth, you disqualify yourself from so many procedures. So
Yeah.
it all counts. So you might walk in like with your friend, but you grind your teeth, and then we say, look, man, we can't do a fiber bridge.
Yeah.
Just say, my friend just did a fiber bridge last week. And it's like, well, the way you bite and the way your habits that you have and your occlusion are not compatible with that.
Like if your teeth, your two missing teeth have been missing for quite a bit, and then your lower teeth, because there's nothing stopping them from going up, just shift. They go up a little bit, and now your lower teeth are like curved like that. Like a normal prosthesis, if we just use the template, wouldn't fit, because we'd probably have to like adjust those or get your prosthesis that would accommodate those changes that happened. So that's that. I hope it does help answer your questions on why we can't really give prices on the DMs or tell you just over the phone how much something is going to cost, because it just might not be what you need. And if we're on the phone and we're talking about all these different types of prostheses, it just won't make sense to you because you're not a dentist. Like, what does that even mean? What do you mean zirconia or gold or whatever it is? So like when we're here, we have the X-rays, we have the clinical examination results, and we have you, and we can talk about your life, your lifestyle, your medical history, and maybe even how you lost those teeth. That will help us in creating the plan that works for you.
Indeed.
So do be patient with us and don't worry too much about the consultation price. I guess that's sometimes it's the price for knowledge.
Mm.
Because I heard how much longer do we have before I go on another tangent?
We're talking.
Yes, another thing, because I saw someone saying that dentists are not treated like health professionals. We often get the same type of treatment as like leisure and entertainment, because the patient will come like, I'm not gonna pay for this because it didn't work, and like, no, we've done the procedure, we've done the treatment, which you have agreed to. So it not working is something which would have told you in the consent form is not a failure on our side or like on your side or the whole us engaging in that exchange. It's just that sometimes they do. And you just have to like, I lost it.
No, I feel you. And he's cooking.
I'm cooking.
Yeah, you
I thought like I'm not making sense.
no. So for example, if you get a surgery done, they'll tell you you've got 50% chance of success, and you pay the money. And if it doesn't succeed, like, you know what,
Like the cancer might come back,
Yeah,
in remission.
yeah.
And then like the cancer is back. Tell that oncologist to pay me
Yeah,
like my money.
no,
No one ever does that.
no. So in dentistry, it's the same thing.
Yeah.
So if we do a root canal and it fails, then it's not an us problem. It's how the body responded. It's many things, because, and I know these dentists watching will say, but the failures relating to root canals. But then I'll say, there's something interesting. I'll share it with you. Oh, it's an interesting study. But there's so many interesting cases about not the things that we think are going to make it fail are not the things that make it fail. So yeah, I mean, it's very complicated. Like we said, dentistry is complicated, unique, not a one size fits all. So that's why we always talk about procedures before we do them, the downsides, the upsides, so that you can know what you're getting yourself into, what are the possible downsides, risks, how this thing could fail, what's its time span, because nobody is the same.
Yeah. And we can't talk about that over the phone or DMs. So do come for a consultation or do go for a consultation at your local dentist or whichever dentist you have selected to just get as much info out of it. Because sometimes even Google won't give you the answers because it's not seeing everything, because you're not seeing everything as well. So, mhm.
And that's it.
Thank you for joining us and watching till the end. We're always excited to make these videos for you. We do the talking and someone else does the hard work of editing. But hey, you showed up.
Luto, you guys, the
Thank
job
you.
is on you now.
Thank you.
Thank
You
you.
deserve a McDonald's. Bye.